the live lab. All right. So we are done with coding. We are officially into medical office skills um, and MOS, the simulated software. What do y'all think? I haven't heard anybody really, I haven't heard about any big glitches or anything crazy that anybody couldn't complete anything. So I'm taking that as a good sign and that everything is going well. Or how are y'all liking it? Or y'all, is there any issues that y'all are having? Or, anything I need to look into at this point? Or is it working pretty good for y'all?
I actually like the medical office. But I did have a question though on the other modules, since I know you said we're done with coding. Okay, the
Mhm.
coding with the encoder software, those are things that I seen that we had for a grade, but we haven't really got to it. So, like, I was gonna ask you about that like probably a week ago, but I really forgot. But yeah,
We're not using encoder.
okay,
Um, so yeah, like there's going to be stuff sometimes in Cengage that says marked for counts towards your grade that does
mm,
not.
okay,
Sometimes I don't catch everything. I miss stuff sometimes. So there might be something that says it counts towards your grade, but it will not count towards your grade.
okay,
Because when I go to finalize grades, I go back through to look at everybody's assignments. And if I see something that shouldn't have been there, I take it off at that point. So
mm,
that's why I say follow along in the Unitech site, not in Cengage. As long
okay,
as you do everything that's listed in Moodle, you're good to go.
okay.
You know, because yeah, every now and then there will be something in there, but yeah, we're not using encoder. We tried. We did try the last time we were we started coding. We tried to use the software because that is used in a lot of medical offices, and it just we could not get it to work right for our students. I don't know what if there was some compatibility issues between encoder and Cengage or Moodle or what. We just could not ever get it to function right. So we went the digital CPT manual route, and I think that's a little bit better because that gives y'all more of an if you use nothing but encoder while you're in the class, what's that manual going to look like during your exam the first, and
Right.
you've never looked at a page out of that manual before you've been using encoder. So I think it's actually better that we do it this way, but we
Okay.
would have loved to have been able to have our students use encoder because that is what is used in a lot of medical offices to look up the codes. Like I said, a lot of this software we use encoder and they have built-in tools like encoder to help us find these codes. So the manuals are not as widely used, but you do still have to know how to use the manual for your certification exam because they want to know that you know the basics, you know how to find the information if you need it. Great question, Sky. Great question. All right, I did have somebody ask me a question about the percentages. Like, when you click into the Unitech site and it'll show you a percentage for the course. Um, some of y'all may have noticed that that never gets to 100%. It never will. For some reason, and I can't figure out why, after 2 years of using Moodle, I still cannot figure out how to get that percentage to get to 100%. Have not figured it out. So please disregard it and don't think that you're not doing something. As long as you've got all how many ever days worth of work listed in Moodle done, you are good to go. Okay. Um, let's see. As far as announcements, we only real thing we got coming up is NCCT is still going on Tuesdays. Y'all can hop in when you feel you're ready for that. And I haven't heard anything about which day we're going to have off for Easter yet, but I will try to find that out this week. We had we have what's called compliance audits this week for our accreditation. The national school boards that make us an accredited university come in and they audit our records and our grades and our students. They look at your files and different things and make sure that we're doing what we need to be doing to stay accredited. And that's going on at Unitech this week. So it's a little it can be stressful for our office staff. Let me put it that way because you've got people that are not normally in the office and asking you to pull documents and records and things and provide information and stuff like that. So a lot going on at Unitech this week. But so for today, what we're going to talk about, what I want to get into with y'all, because we're into front office skills. Here's my little file thing. I'm going to share my screen. I've got a couple of quick slides, but we're going to talk about some different, we're going to talk about each. Where is my little downloads? Okay, did it as a PDF. Don't know why, but that's okay. Let me share my screen. All right, can y'all see the screen that says equipment and software?
Yes.
Awesome. All right, so what we're going to talk about today is a little bit about the EHR software that y'all are now using in the simulation in your labs, and the equipment that you're going to be using and the software that you're going to be using on a daily basis in a medical office in general, no matter what position you hold. These are things you're going to use. So the reason that we ask you guys not to do, if you have to submit a daily assignment on your phone or something like that, we get it, because we're all leading busy lives. But we love for your work to be done on a laptop or a desktop computer, because all of your work in a medical office will be done on a computer. Point blank. The easier you can navigate the computer, the easier your job will be. Make sure you're proficient at common tasks, such as working with files. And this means accessing, which means learning how to find a file on a computer, saving them, editing them, sending, and organizing. Okay, and when I say sending, I mean like through email and stuff like that, sharing them with other coworkers and stuff like that, or sending them out to insurance companies. Sometimes we have to send documentation out. You want to know how to navigate web pages. And guys, I know some of this may seem real basic to y'all, but to somebody who's never worked in an office before at all, this is new stuff. All right, navigating web pages, setting up logins, bookmarking. Bookmarking websites is a big one, guys, because especially if you work in the billing department and you verify insurance, you work at that front desk, you're going to have Blue Cross has their own website. United Healthcare has their own website. Vantage has their own website. Medicare has their own website. And your office has a login for every one of those. Each employee in the office may have a different login for every one of those. It just depends on how your office sets theirs up. But you've got to get efficient at hopping in these systems, switching pages, and going in between where you need to go. Okay. And bookmarking will help you get there fast, right? We bookmark it because we've got to go there all the time. And basically finding the information you need, using search engines, searching the insurance. A lot of times they will have like FAQ pages, frequently asked questions that'll explain things. They have support that you can get in touch with if you need something explained to you, or information that you're trying to find. And one of the biggest things is email. Y'all, we do so much by email now, almost everything. We used to, when I first started working in this industry, about half of our claims, maybe more than half, maybe 70% of our claims went out electronically. And the other 30% either went out via fax or paper. We had a printer in the middle of our office where we would print them out and mail them, paper copies of the medical forms. Nowadays, I'm going to say 95% of the claims are going electronically. 95% of everything is going electronically. Now, claims usually don't get sent in emails. They get sent through your EHR systems in batches at the end of the day. Each employee submits throughout the day, and then at the end of the day, they all get combined and sent out, okay, in what they call a batch. But sometimes if you're working on like a denial or something like that, you may have to email a certain representative from an insurance company or something like that. And email is going to be widely used in your office along with, I need to add update this and add Teams to it, because that's the other thing. Get used to communicating in written via email, sending, receiving, and organizing your emails. Organize your inbox. If there's like one insurance company or one doctor's office or one, somebody that you communicate with a lot, or that you find yourself having to reference their emails a lot, create them their own folder and put all their emails there so you can easily find them later. And let's see. And like I said, Teams. Get used to communicating on Teams, especially if you want to work online. If you're working in a big hospital or a big clinic, somebody's not going to walk across the building to ask you a question. They're going to send you a Teams message, and you're going to be expected to respond fairly quickly. Most medical offices use Microsoft Office software to complete tasks. It is a good idea to get very familiar with the following programs: Microsoft Outlook for your email, Microsoft Excel for spreadsheets, and Microsoft Word for typing up letters and other documents. You have access to all of these through your Unitech Microsoft account, and that's why, because this is stuff that you're going to be using on a daily basis, okay? If you're not already. Some of y'all might be already. And if you are, then good, you're ahead of the game. All right, so let's dip into EHRs specifically. All right, so EHRs are electronic health records. All right, some of the benefits of EHRs include easy storage of patient information. You remember way back in the day, you go to a doctor's office and behind them, there'd be a wall of files, and sometimes they would even like move, and they were crazy, full of files. Some stuff they still have to keep paper files on. A lot of things are now done electronically, guys. So easy storage of patient information, availability to multiple users at the same time. If you're working off of a paper file, it can only be in one person's hands at one time, right? You can't have multiple people working out of the same paper file. But if they have an account in a computer system, they may be seen by the doctor up front, and so in the back could have their account open, working on the billing of their last visit that they were there for, or something like that. So it allows us to be able to work faster and more efficiently, and more efficient claim submission process. And that's the big one for EHRs, guys, is getting the claims out to these insurance companies. And the EHRs allow us to do that because it allows us to take the patient information, take the claim information, take the documentation, add it all together, and then send it out all at one time. Instead of having to manually do everything by paper, fill all this out, copy this, attach this, send that. I mean, it was a lot, y'all. It was a lot. Okay. So EHRs have helped us just streamline everything and make it much faster and much easier. So it's important to be aware of the differences between the practice management software and the EHR. Okay. So EHR, an electronic health record, contains a record of patient interactions and health history. This is like individual to the patient, all right? Their collection of digital medical records. The practice management software allows the facility to operate the business side by maintaining the schedule, like the appointment book, and the financial information, the billing processes, okay? For revenue cycle management and reimbursement, right? So you've got like Moss is a certain software. There's also the one that Ochsner's uses is called Epic. That's their practice management software, and it has built-in EHRs for all, for all the patients. The EHRs are contained in the software, and the software does what it does. The increasing use of EHRs brought about the formation of HIPAA in 1996. So about the time that the internet got big and we started doing things on computers and we started putting patient information online and trying to pass it from doctor's office to doctor's office or from doctor's office to insurance company. And there's hacking, phishing, scams, all this stuff, that data breaches you hear about. HIPAA was created to try and prohibit a lot of that for the medical industry. Um, HIPAA was passed. It's a set of laws, basically, that we have to follow to make sure that our patients' information stays secure. That's the whole point. It's just the set of rules you follow to keep patient information secure. Okay. And let's see. Next page. We're going to go into more about HIPAA next week. I thought I might have had it on the next slide, but I think I decided to wait to go into more detail next week, because this week y'all are doing more of the scheduling, appointment taking, the real beginning front end stuff. But that's why HIPAA was formed. When everything started going electronic, we needed a way to safeguard that information, and we have HIPAA. And like I said, we'll get more into that next week, because HIPAA is, you will have in your company, whoever you work for, whatever doctor's office, insurance company, regardless of who you work for in the medical industry, you will have annual, yearly HIPAA training. Okay. Most like outsourced billing companies or doctor's offices, they have one person whose job it is to make sure that the entire company stays HIPAA compliant. That's how big a deal it is. And I'll show y'all why it's such a big deal next week. I'll leave that for next week. We'll talk about why it is a big deal, but it's huge. It's huge. It's one of the most important things we're going to talk about in this program is HIPAA.
CNA here.
Hey, so you already know.
Yes.
You already know.
Mm-hmm.
Yep. HIPAA's a thing, and you probably know some of the information I'm gonna spit at y'all next week about why it's so important and why it's such a big deal. One HIPAA violation can shut down an entire hospital, an entire medical system, an entire clinic, an entire bankrupt a doctor. I mean, it can be bad, y'all. It can be bad. But again, that's for next week. So let's talk about documentation. While y'all are in there putting in the demographics and scheduling appointments and putting in all the information. So documentation for us is one of our key roles. Okay. One of the entry level jobs in a medical office is data entry, just typing in the patient's information, typing in different records and stuff like that. It is vital to document every patient record interaction. That means every time they call, every time they walk in, it doesn't matter if they're calling to say, hey, I just had a question about this. It doesn't matter what it is, document it. Okay. Always include in your notes, when you're making notes, the date of whatever that interaction was, what you did and why you did. Anytime you open a patient's account, you literally look up an account and go into it, you need to put the reason why you entered it. You need to put the reason why you were there. You can't just go dig around just to go dig around in people's records, just to be nosy, even if that is your friend. Especially if it's your friend, you might all just mind your business. Because that's a HIPAA violation. But you want to always include the date, what you did and why. Y'all have heard me talk about reference numbers when you're calling insurance companies. Even if it's a smaller insurance company and they don't necessarily offer one, you want to try to get either their name, date, whatever they use as a reference number. Okay. The phone number that you called, if you called an insurance company, or if a patient called you, and sometimes in the billing office, it's our job to when there's past due bills, to make the call about the past due bills. All right. So if you're able to, if the patient has several numbers listed on their account and you're always able to reach them at one particular number and not the other, you want to make sure you put that in the notes so that the next person that comes along, when they go to work the account, they'll try that number first. And maybe that'll help them save a little bit of time, or the next time you work that account, because usually if they're outstanding, you work them about every 30 days. The next time you work that account, you won't have to try to remember back 30 days what you did the last time you were in that account, which number you called and were successful at, and that kind of thing. Okay. If you're working denied claims, or even just claims that have been submitted sometimes before they've been denied, they'll have a claim number attached to it. If you're working off of a claim number, you make sure that's in the notes. Make sure that the claim number is in the notes, y'all. And the name of anybody you spoke with, patient, doctor, insurance rep, doesn't matter. Who'd you talk to? You want their name. And the all important thing, the golden rule in the medical office, if it's not documented, it didn't happen. You have no way of covering your butt. No way of covering your butt. So that brings me to slide number 4. Why is it so important? And what's number 1? Cover your butt. CYOA. Always, always document everything. Document everything. There's other reasons why it's important. Personally, for me, that's my big one. I like to be covered. I like for it to be in black and white that I did my job and I did it correctly and I did it well. That's just my personal preference. That's why it's at the top of the list for me. But it also makes a lot of other things easier. Ease of verification. Okay. It's a lot easier to verify information if there are notes in the account giving you said information or saying, hey, if they say this, double check it because XYZ, we've got the information there. Workflow efficiency. Like I was saying, you're not trying to remember what you did 30 days ago. You've got it right there in front of you. Susie Q that comes work the account behind you doesn't have to come and ask you what you did 30 days ago. The notes are right there, legal issues. It not only covers your butt, it covers your office's butt. Okay. It covers the entire medical facility, your doctors and everything. And compliance. That's the other one. Like right now for us, like I said, we've got compliance auditing going on. Medical offices have compliance auditing too. The biggest one and the one that happens the most frequently is Medicare. Medicare audits offices all the time, constantly. They're constantly coming and taking back money that they paid 2 years ago. It's ridiculous. It is really ridiculous. But if we have all of our notes documented, okay, I was working denied claim, it paid this date, Medicare sent payment on this date, it was posted on this date, they came back 2 years later, payment's gone, but there's no notes. Where'd the money go? It has to be in the notes where the money went. You have to come back in the notes, and whoever, entered that deduction in has to notate. Medicare took money back, saying claim was not payable at time of service, refunded, blah, 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 blah. It's all got to be in there and accounted for. And I think that was it. All right. So that's the main things that I wanted to get through to y'all. When y'all are in these patient accounts, look for those note tabs. Get used to documenting everything. Entering in patient demographics. You want to be as accurate as you can be when you're entering in those demographics because it affects everything after that. Everything after that in the office. If one digit or number is wrong, then we have incorrect information on the claims, and the claims are automatically going to come back to us when whoever bills it goes out. So it is vital that our front office workers, our people who enter our data, our demographics, our insurance information, that they are doing it correctly, right? We want to be as accurate as possible and document everything as accurately as possible. That's the 2 big takeaways for today. That's the 2 big ones. Next week, like I said, we're going to get into HIPAA compliance, some other documentation, But and we're going to get into also like a few healthcare law things. We're going to talk about some healthcare laws that come into play when you work the front end of the office, when you're doing new patient registration forms and this and that. There's a few laws you need to know about that they don't affect us on a day-to-day basis. But number one, you're going to be asked about them on your certification exam. They want you to know the principles of these laws. One's the Stark Law, one's the HITECH Law, and HIPAA is the big one, of course. So we're going to talk about those next week. That's going to be the my brain just went blank. Y'all, perimenopause is not fair. The subject, the goal, what we're going to talk about next week. The word is just not there. It is just not there. Okay. Any questions, concerns, anything else before we let go for today?
I think I'm good.
Good, Melanie. Good, Sky.
Yes, ma'am.
Hey, Robriel. I'm gonna check the chat real quick. No issues. Very good. Any questions before we go, Robriel? But as always, you guys, nope. Okay, good deal. Y'all, that's when it's the best, when everything is flowing smoothly, everything's going good, and we're just scooting right along. That's when it's good. Um, have a wonderful weekend. As always, thank y'all so much for giving me your time today. I really, really appreciate it. And I will talk to y'all next week. I'm here if you need me.
Thank
Thanks.
you.
Thank y'all.